Frustrated after botched Restylane treatment, considering surgery. 22-year-old male, 23 days post-op. Had Restylane injections to reduce tear troughs under eyes. Now it's visibly worse and there is still bruising, discoloration around the injection sites. Before it used to look bad in certain lightings. Now I have huge bags under my eyes in every circumstance. I can barely go outside. Doctor injected half a syringe, but it made it worse. Now he wants to correct with the rest of the syringe. How can I trust it won't get even worse? Can I get surgery after Restylane, or do I have to wait? Help.
Thank you for your question. You're 22 years old. You underwent injections of Restylane in the tear trough approximately 23 days prior to your submission. And you submitted photos where you described that the area actually looks worse, that you have greater amount of swelling under the eyes, and that there is bruising and discoloration. You additionally describe a situation as your doctor offering to use another half cc of Restylane to further correct, and you're also questioning whether or not there is a value to doing surgery, or can you have surgery to take care of this. Well, I can certainly give you my opinion. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. The concerns that you have is reflective very much of a large part of my practice, which is rejuvenation of the eyes, whether it's through cosmetic surgery as well as the use of injectable fillers and new technologies for rejuvenation in the stem cell world, such as the use of platelet-rich plasma. So, to begin with, I would then comment on the photos that you submitted. If the fluid or the swelling that you describe it has occurred after you got the 1/2 cc of Restylane under your eyes, I'm a little bit concerned on whether or not additional Restylane would be necessarily of value. Now, this is not to second guess your doctor. I think that if you chose your doctor based on your perception of the doctor's ability to do the treatment, the injection of Restylane in the tear trough area usually doesn't create profound swelling under the eyes. So the question I would ask you is to look at your photos before you had the injection. Did you have the fluid that I see at the cheekbone that's right below the orbital rim, below the rim of the eye socket? If that swelling was always there, then that's more of a situation of what's called malar edema. If that swelling is subsequent to the injectable filler, then that's a different story. Usually injectable fillers such as Restylane can in certain cases cause more swelling by the virtue of the fact that hyaluronic acid is very, very hydrophilic. It pulls fluid in. Now, there is a finesse to doing this. It is routine for me in my practice to treat tear troughs with a hyaluronic acid filler like Restylane, combine that with a regenerative technology using platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it's a concentration of growth factors that stimulate this collagen and blood supply and improve the color of skin under the eyes, which is very, very difficult to do because of the intrinsic nature of the delicate and thin quality of the under eye skin, which is the thinnest skin in the body. With that being said, it is also part of, in the philosophy that I work with, is that the patient who I treat for these type of situation or any type of procedure we have an ongoing relationship where I'll do the treatment, I'll see them 2 weeks later to reevaluate how things look. with the nature of injectable fillers, there is often a transition period where it takes time for things to settle down. Now, you're 23 days after the injectable. It would be interesting to understand your doctor's thinking. I have a feeling your doctor is focused on the hollow part and not necessarily on the swelling. The doctor may feel that the swelling is just par for the course and it may be something that you'll have to accept. This is something that that is, of course, a personal choice. But in my practice, when people who are your age come in for injectables, I often try to talk them out of it. Mainly because I feel like there's a different lifestyle in your 20s compared to your 40s. In your 20s, if you're going to try to make this something sustainable, you kind of have to accept what people in their 40s accept, which is that you're going to do these treatments on a regular basis. You're going to have to deal with some swelling, some bruising, and it does require ongoing maintenance. I can understand why you're asking about surgery, but I would caution you about choosing surgery. I don't think surgery also is a good idea at this stage. You don't want to create more problems, and surgical solutions for tear troughs are less than perfect. I think that injectable fillers have a lot of value in the treatment of the tear trough, but you have to just kind of figure out what is right for you. In scenarios like yours where someone has swelling, whether it's in the tear trough area or anywhere else in the face, I often will use hyaluronidase just to dissolve the filler. If it's a hyaluronic acid filler, hyaluronidase will actually dissolve the filler, and then you can restore closer to your original anatomy. It does affect the hyaluronic acid that's native to the area, but at least there is some potential benefit by getting rid of the factor or the element that is causing the swelling to get worse. I think you need to have a good discussion and spend some time with your doctor to go over this and to understand the risks and benefits of the additional syringe as suggested, and think to yourself, is doing this on an ongoing basis worth it? And is this the right thing for you at this time of your life? So I hope that was helpful. I wish you the best of luck, and thank you for your question.